important work. And I just want to take a brief moment to get us into a space of gratitude. Some of the things you'll hear today may be frustrating and may be hard to hear because it's bad news. So let's just take a few moments to just be thankful for what we have and be thankful for this opportunity we have now to create real connections and real relationships. And just as a note, if we don't get to your question today, I encourage you to reach out to those on the panel and to anyone so that we can have more relationships in our community. So briefly, I want you just take a few seconds, look around where you are in your room and find 5 things you're thankful for. And then tell yourself why you're thankful for them. So I have a lamp over here to my right, and I'm thankful that I can afford to pay my LG&E bill. So just take some time, find 5 things you're thankful for. You don't have to share it, but just get into a space of gratitude. Does anyone need any more time? All right, well, let's get started. We have a really informative and impactful panel here today. Those of you who are in the audience, if you want to, please take time to introduce yourself in the chat. You can give your name. If you want to give pronouns, you are free to do that. Your organization and any contact information if you would like to build some connections on this meeting. So I want to welcome everyone to the panel. I'm going to look at my phone. That's where I have the panel list. All of our panelists are going to spend about 3 to 5 minutes briefly explaining some work. And then after that, we'll open up to Q&A. All right, so let's kick it off with Cathy.
All right, I'm going to attempt to share my screen here. All right, hopefully you can see that. So good afternoon, everybody. My name is Cathy Kuhn. I'm the Executive Director of the Metropolitan Housing Coalition. And so my job today is to just kind of set the stage a little bit about why we are having this conversation about evictions. And I'm going to do that by just kind of giving the big picture overview around how important this issue is to the overall health and well-being of our communities. And then the presenters that follow me are really going to sort of dig more into detail about what's happening on the ground in Louisville. So, you know, as I'm sure you can imagine, there has been a lot of research that has been done about the wide-ranging impacts of eviction. And what that research generally shows is that, probably not surprisingly, the effects of an eviction on an individual or family can have very far-reaching implications. So, you know, for example, just in terms of health-related impacts, what the research shows is that evictions and even just the threat of an eviction are identified with negative mental health outcomes like depression and anxiety and psychological distress, as well as with negative physical health outcomes like high blood pressure, you know, increased substance misuse and suicidality, among others. And now there is new research that's beginning to show the public health implications associated with evictions that are occurring during the pandemic. And you will hear that that is still occurring. And so what we know is that evictions often cause people to live, you know, in overcrowded environments. Sometimes they're doubling up, sometimes they're tripling up. And that really leaves them unable to practice even the most basic pandemic mitigation strategies. And as a result, what these studies are showing is that allowing evictions to proceed during the pandemic is associated with an increased rate of COVID-19 infection and death. And then, of course, you know, in addition to sort of those immediate mental and physical health related outcomes, it's important to point out that the effects of an eviction on adults and children really reach far beyond that they are removed from their home. So, you know, as you might imagine, eviction is a major source of familial instability. It can lead to job loss, economic insecurity, and it's related to decreased educational performance in children. And studies have also shown that people who have faced an involuntary displacement are more likely to experience long-term housing instability. So an eviction can prevent people from qualifying for public housing or other subsidized housing programs. It, of course, can damage credit ratings. And importantly, because an eviction record is public, having an eviction filed against you can, and often does, hurt your prospects of renting housing in the future. I think it's also really important to point out that the issue of eviction has significant racial justice implications. In Louisville, people of color are more likely to be cost burdened in terms of their ability to afford their rent and are far more likely to be evicted than are whites. And the last sort of big picture thing that I'm going to point out today regarding evictions is that there is new research that's showing that preventing evictions is not only critical to ensuring, the health and well-being of struggling renters, as we've sort of discussed, but it's also more cost effective to society in the long run. So there was a recent study that was conducted by the University of Arizona and the National Low Income Housing Coalition that found that in Kentucky, approximately 196,000 households were at risk of eviction. This was back in sort of late last year, late 2020. And if those households were to be evicted, it would amount to a projected cost of almost $2 billion in expenses associated with emergency shelter, inpatient medical care, emergency room expenses, foster care, and juvenile delinquency. Now, obviously, there are far more public costs attributable to evictions that are not included in that estimate. But really the clear lesson is that, investing in a robust prevention strategy is far more cost effective than responding to the long-term physical, mental, and behavioral health consequences that eviction can have on adults and children. And in the last sort of 30 seconds that I have, I just want to pivot for 1 second to be sure that people are aware of an issue that's happening right now in our community that the Metropolitan Housing Coalition is very involved with, that does have a direct impact on evictions, which is the current LG&E rate case and the proposed increase to the cost of utilities. So obviously the timing of this rate case is very unfortunate. But in addition to that, there are a number of other sort of problematic features associated with this proposal, the biggest of which is just the sheer magnitude of the proposed rate, and that which will certainly, put many more people in jeopardy of losing their homes. Currently, we show 21,000 people that are behind on their electric and gas bills with LG&E, which is almost double the amount of people who were behind last year. So this large rate increase right now is certainly going to create additional stress and hardship for these families who are already struggling. So we are very much encouraging all residents to get involved in the rate case. And I'm going to put some information in the chat that will tell you how you can do that. So that I'm going to stop. With that, I'm going to stop and I'll allow our other panelists to kind of get into more detail about what's happening here in Louisville.
Cathy, thank you so much for laying the foundation for what we're going to discuss here. And thank you for all the work that you do. And if you could maybe put your contact information in the chat too. Thank you. So let's move on to Harrison, who's going to tell us about some data.
Thanks. I'm Harrison. I'm the data scientist at the Greater Louisville Project, and I'm going to talk about the housing data that we compiled to share with the community and create some background for this conversation. We have compiled a lot, so I'm not going to be able to explain all of it in detail. I'm really just going to point out what we have put together, some of the takeaways, and what I would encourage you all to go follow up with. Can you all see the report? Okay, great. So the main data that we compiled is called the Rental Insecurity Index. And it is a graph designed by the Urban Institute to prioritize rental assistance going towards stopping evictions in Louisville. It combines 3 different sub-indexes. One is the Housing Insecurity Index. So what kind of housing insecurity already existed in these areas? 2 is the impact of the COVID-19 pandemic on these areas. So who is most likely to be affected by job loss or lack of health insurance? And lastly, there's equity subindex, which is essentially noting that we should prioritize areas specifically where Black people or other people of color or foreign-born people live, because they've been historically marginalized by housing policies. So if we want to correct that, then we need to prioritize them in our response to this issue. Essentially, we've identified a few areas in Louisville that we think would be best suited for rental assistance based on this data. A lot of it is in the West End, some of it is in Buchel, but there are also other areas of town that come up because even though, say, towards East Louisville, the average population has high incomes, there are a lot of low-income people there, and a lot of low-income people who work in industries that were heavily affected by the COVID-19 pandemic. So with my 1 minute that I'm going to allow myself remaining, I'll just mention some of the other things that we have in this report that might be interesting for you to follow up on. We have created a lot of this data in Metro Council district levels. We have been working on translating data from the Census Bureau to Metro Council districts to make it applicable to local policymakers. We also have data on home mortgages, housing price changes, and housing availability. A lot of this data that I mentioned isn't really available by race, but our home mortgage data is. And the big takeaway there is that in 2019, white residents received $2.60 in mortgages for every $1 that Black residents received. There's more information here on denial rates, interest rates, those kinds of things. That is my timer. So just to explain the other things, we have graphs of how home prices have been changing in Louisville over the last 5 years and since 2000. And we also do a comparison between the incomes of the people living in Louisville and the housing stock that is available to them. In accordance with the housing needs assessment, we find that there's a lack of housing available for people making under 30% of the area median income. So I'm happy to talk to you about the data. I encourage you to go explore more and let us know if there's anything that we can provide to you or how you're using it. I turn it back over to you, Monica.
Thanks, Harrison. And as Harrison said, we here at GLP, we are here to assist you. So just let us know what we can do and we'll see how we can support your work. So now let's move on to Celine, who's going to take us beyond the numbers.
Hi, everyone. My name is Celine Mutuyemariya, and I am the Community Health Coordinator at Shawnee Christian Healthcare Center. I will need the full 5 minutes, just a heads up. So Shawnee Healthcare is a federally qualified healthcare center located in the west end of Louisville in the Shawnee neighborhood. We provide a comprehensive array of services, including primary care, dental, behavioral health, and community health services. As a community health worker or a CHW, one of my roles is to act as a liaison between patients and their providers to help bridge the gap between what happens in the healthcare center and what happens outside of the healthcare center. And at Shawnee, we recognize that the best way to improve health outcomes is to acknowledge that there are two experts in the healthcare relationship. One expert is the provider who is able to diagnose a health issue and offer an array of treatment options. And the other expert is the patient who is able to provide feedback about what's working, what isn't working, and what they need to achieve their health goals. CHWs provide education, support, and tools to encourage patient engagement in the management of chronic diseases like hypertension and diabetes. And through this work, we are often made aware of barriers patients experience in accessing social determinants of health, like transportation, access to fresh, healthy foods, telecommunication resources, and of course, housing. As a CHW, I work with clients to tackle a number of issues, and nothing is as daunting as tackling housing insecurity. Now, when I talk about housing, I want to specify that I'm talking about the lack of multifamily rental housing in our city and state. And the reason for this specificity is of the programs I've interacted with that were created in response to our housing crisis, most, if not all of them, focus solely on home ownership and the creation or protection of single-family dwellings. I don't know about you all, but I can't think of anyone who has the superpowers needed to jump from housing insecure to homeowner. What I've learned as a CHW is that our city lacks programming that addresses the need for emergency and transitional rental housing that is secure, accessible, affordable, fair, and equitable. In my experience, I can name exactly 4 programs in Louisville that provide affordable rental housing options, and the minimum amount of time it takes to get off the wait list for these is at best 1 year, and at worst, well over 3 years. Anyone who is familiar with Maslow's hierarchy of needs can understand that human beings must have shelter, warmth, security, and safety to accomplish even the most basic of daily needs. So how can I expect my clients to have the capacity to engage in the self-management of a chronic condition like diabetes when they don't even have a refrigerator to store their insulin because they have been housing insecure for years? I believe that housing is a human right, and I would like to share 2 of the many lessons I've learned in the housing navigation and advocacy work I'm involved in. The first lesson is that any program or policy developed to address our housing crisis should be informed by, and more importantly, routinely evaluated by people who are housing insecure. Those who are directly impacted by these issues are best equipped to explain what they need. This is reflective of the medical model I described earlier, in which we honor that directly impacted communities have agency to tell us what they need, and we, in response, have the power, privilege, and access to create systems that meet those needs in an equitable way. When people are asked to create solutions to issues they have never faced, oftentimes what we're left with is the creation of well-intentioned but racist, biased, privileged, and inaccessible resources. The second and most disheartening lesson that I've learned is that just because you provide facts and data and anecdotes that clearly demonstrate why an eviction moratorium in combination with mortgage assistance to landlords would be the most effective way to help Kentuckians survive this pandemic doesn't mean that leaders in the executive or judicial branch at both the state and local level will listen. Can you believe it? What a surprise. Nevertheless, what's kept me going in this work is witnessing how my clients and community members refuse to back down, despite feeling silenced and abandoned by many of our local and state leaders. So to close, I would like to leave you all with 5 action items. The first, think about how our unconscious and conscious biases influence the assumptions we make about poverty. To question why we criminalize homelessness while continuing to divest from housing. To study how the power imbalance between landlords and home renters exacerbates our housing crisis, to amplify and fund the work of community members who know exactly what they need because they have had to survive this crisis for years and are actively working towards solutions. I can point you all to several people. And lastly, to act with a sense of urgency because the data is clear and we have the money, we just have to choose to reallocate our dollars to the most vital community needs. Thank you all for having me.
Celine was preaching, y'all. I just want to note that there are a lot of young people doing this work. Celine is a young person doing this work. We need to embrace them. We need to give them an opportunity to stand up because they are wise. You know, you don't have to get gray hair to be wise. So let's embrace Celine and others and let them come and speak. All right, thank you. And also Celine, if you could put your 5 action items in the chat, that would be really helpful. Now we're going to move on to Claire, who's going to speak about accessibility.
Yeah, so Celine and I work very closely. We've actually met during this, well, in 2020 and have only met in person like once very briefly, but we work very, very closely. So you'll hear a lot of the same language, but you know what, it's worth hearing twice. I'm Clare Wallace, and I'm the Executive Director of South Louisville Community Ministries and the Vice Chair of the Association of Community Ministries, which is a network of 13 independent agencies that cover all of Jefferson County to help ensure that our neighbors' most basic needs are being met. A focus in my work, especially in the last year, has been around accessibility to available services. As Celine described, when someone is facing a crisis and their home and ability to eat is being threatened, they are simultaneously trying to navigate really complicated systems and processes while dealing with this trauma. For-profit companies spend millions of dollars on user experience design, but in government social services and the nonprofit sector, these compassionate and intentional processes are hard to find. On August 1st, I launched StopMyEviction.org as a project of Louisville's Rapid Access Network, which is a network of mostly direct service providers who are thinking through the barriers people are facing. StopMyEviction.org connects someone who has been behind on rent with an intake coordinator who is trained on the complexities of applying for assistance. That navigator was then able to help answer every question that person might have, listen to them for as long as needed, and walk with them through the entire process of getting assistance, from making an appointment to confirming their landlord received the check. Since that time, we have served more than 2,000 households, and already 1,000 people are currently waiting for that next round of CARES Act assistance that we're hoping is coming in February. Without this tool, it would feel impossible. It did feel impossible to get the help you need, even though you hear on the news every day that there's assistance available. You could Google, I did, rent assistance in Louisville, and nothing helpful will come up. You can call Neighborhood Place and potentially make an appointment through an automated system, but then you have to wait 3 to 4 weeks to actually speak to a person. People are not data. They are not numbers in a system. They are our neighbors that have different capacities to advocate for themselves and sort through an ever-changing system. It is not fair, effective, or kind to expect those living in trauma of poverty to navigate this on their own. And by listening, truly listening, and walking with someone through their experience, it is incredible what you can learn. What questions are they asking? This helps answer the question about what we are assuming they already know. What barriers do people continue to face? If a majority of people are getting stuck on the same one step of the process, we need to fix that one step. We build these relief programs often based on our own realities. We create processes that reflect our own privileges, knowledge, and capabilities. If we want people to be safe and have their basic needs met, we have to think about accessibility, gaps in services, and genuine collaboration between service partners. There is no one-stop shop. It requires an interdependent network of people and support. And the only way to navigate through that network is through relationships. We need to create systems that prioritize and allow for time and space to listen to people throughout the process, trusting and honoring their experiences and making the changes that the people we claim to serve are asking for. This will be a shift in culture. I'll say it again, this will be a shift in culture, and we will have to change a lot of what has been in place for a very long time. But now is a great time to push forward together. So thanks all.
Thank you, Claire. And I love that you mentioned a shift in culture. Shifts can be scary, but they can also be fun. So we got to look at this as like, hey, we're going to do this great. This is an adventure and we got this. So thank you, Claire. Oh, wait, George, I skipped over you. I'm so sorry.
It's okay.
Okay.
I'm just shifting over here in my office by myself. So everybody, my name is George Eklund. I work with the Coalition for the Homeless as their Education and Advocacy Director. I'm going to touch a lot on what Celine and Claire have just said. I get to hang out with them quite often in doing this work. So in general, we've lived with and accepted a housing crisis, mostly because it's expensive to fix and it's never pressing in terms of like the here and now. We can always find some other issue that we want to focus on. We've lived with that for, I would say, 3 reasons, or it's happening because of 3 reasons. One is we don't pay people enough here in Louisville. We don't pay people enough in Kentucky. We don't pay people enough here in the country. 45% of Louisvillians are rent burdened. Our eviction rate is twice the national average. So in New York, or Louisville has 3 times the number of evictions that take place compared to New York City. We have 5,000 JCPS students that experience homelessness at some point during the school year. And there's no county in America where you can make minimum wage and a 40-hour work week and afford the median rent in that area. Another factor that we have is that we don't have enough housing. And Harrison spoke about this. We need 30,000 units of affordable housing for those that are making 30% AMI. So that is a teaching assistant at JCPS with 2 kids. Like that is those frontline workers that we've been uplifting so much during this pandemic, and it's a much more common like category that people are in than we really think. You know, at the same time, we have 14,000 people that are on the Section 8 waiting list, and these are all numbers that we've heard before. But something that a lot of people that I talk to don't realize is that we have completely shifted our funding policy, our funding priorities at the national level from actually producing housing. So in the 1970s, HUD's budget in today's dollars was about $500 billion. Since the cuts in the 70s and the 80s, we were paying, last year's HUD budget was in the realm of $50 billion. And if you compare that to what we were paying for the mortgage interest tax deduction, so subsidizing people to have expensive homes, we were spending more on that than we were actually like helping those that are really deserving and needing affordable housing. The other piece of this is race. So we can't talk about housing without discussing race and like the history of the world that we've created and we're okay with over the last 60, 70 years. I believe like race is the nexus of oppression, and that oppression has taken the form of housing, or it has come in housing. And we look at policies like blockbusting, we look at redlining, we look at the FHA guidelines that were given out, restrictive covenants. These are all intentional policies that denied housing to communities of color. It denied wealth to communities of color. And I've spoken with people who, you know, they're real estate agents and they have property in the West End, and they look around and they say, my house would be worth twice as much, 3 times as much if it was in St. Matthews. It's the same house, it's the same square footage, it's the same condition, but the zip code determines what it's worth. And you know, housing is the foundation that we all thrive off of. Celine spoke about, you know, it's a place where people can get healthy. It's a place where kids can do their homework. It's a place where people can get ready for a job. It's a place where we can just go home and rest and spend time with family. And it's a place where we can like seek refuge during a pandemic. And because we've denied that to so many people, like we're still living with these consequences and these decisions that we made decades ago. And it's gonna take decades for us to rectify it. And I applaud. I'm going to just like say, yes, do exactly what Celine was saying in those 5 action items. I think we need to really examine how are we perpetuating these issues today? And we need to look at like our zoning laws. We need to look at our tenant laws, which haven't been updated since the 1970s. A lot has changed since 1970 when they passed IRLTA. We need to really examine how are we criminalizing poverty and how are we perpetuating the paradigm that there is something such as the deserving poor. We need to create systems that are streamlined and easy for people to navigate. And, you know, and we just have a lot of work to do. I'm very excited just because there is the opportunity for us to change and for us to move forward in transition. So thank you so much. I'm sorry I yammered on.
No, thank you. And I apologize for skipping you. So George and anyone else on the panel, if you have calls to action, please share those in the chat. I'm seeing a lot of heart tugs in the chat where people are responding. If your heart is tugging hearing these panelists, that means that you're ready to take action. So let's go with it. So we're going to go back on the agenda, sorry, with Cassandra.
Hi, good afternoon, everyone, and thank you for the introduction, Dr. Unseld. So good afternoon. I'm Cassandra Webb, Director of Innovation and Research for Cities United. Cities United supports a national network of mayors, as well as other elected officials, young leaders, local community organizations, and national partners who are committed to reducing the epidemic of homicides and shootings among young Black men and boys between the ages of 14 to 24. Our vision is to build safe, healthy, and hopeful communities for young Black men and boys, their families, and communities. Under the leadership of our Executive Director, Anthony Smith, we have grown to over 100 cities signed on to Cities United and work with 30 of those cities closely to convene and build comprehensive public safety plans rooted in social justice, equity, youth voice, as well as youth voice, collaboration, and innovation. Our approach to this work is rooted in the public health approach. We believe that in order to see the changes, to see the reduction of community violence, to see safe, healthy, and hopeful communities, our approach must be rooted in these tenets, and cities must shift their definition of public safety and that funding to align and prioritize Black communities. Although our work is national, we are proud to call Louisville home and have our office located in the Russell neighborhood. We are also energized by our place-based work in Louisville, which includes our Civic Engagement Fellowship in the city of Louisville with the Thrive Fellowship, as well as Lexington with the Coach Fellowship, and our work, Russell, A Place of Promise. Both projects are connected to Cities United's 9 solution areas to safe, healthy, and hopeful communities, but particularly they're tied to building an inclusive economy and bolstering family support. Both projects push for city government, funders, and community to reimagine the way we prioritize and invest in our communities, follow the leadership of young Black people, and change the policies and practices that have historically harmed Black communities. Today, my colleague, Teresa Zuwaki, co-lead of Russell Place of Promise and executive on loan from Louisville Metro Government, and I will share our work in Russell. So Russell Place of Promise, which we lovingly call RPOP for short, is a justice-based initiative focused on generating investments in the people and places that make the Russell neighborhood special. As other panelists have mentioned, there are historically and current policies, practices, and procedures from local, state, federal government, as well as the private sector that have harmed Black communities like Russell in Louisville and across the country. Our strategies are focused on shifting and realigning how these particular entities invest in Black communities like Russell and build Black wealth for Black residents of the neighborhood. These strategies include housing, stabilizing existing homeowners and renters of the neighborhood, making sure that there's access to affordable housing, and supporting a pipeline of home ownership. 2, we're focused on business, traditional and non-traditional business models that elevate Black business owners in Russell. 3rd, focus on workforce development that includes higher wages and quality jobs that provide access to healthcare and other needs for individuals in the neighborhood. And lastly, it's policy and advocacy. We can have these programs and strategies that focus on individuals and families that is much needed right now, but there's much to be done on a local, state, and federal level around policy and advocacy work that really will create an environment where Black wealth building is a possibility. We are exploring universal basic income, or UBI, which is a model that has become increasingly popular since the start of COVID-19, but from the work of Mayor Michael Tubbs from Stockton, California, has really grown, especially around mayors across the country. There are now 32 mayors across the country that have signed on for Mayors for Guaranteed Income, and we're really interested in exploring the possibility of starting that pilot project here in Louisville, and particularly in Russell, so that it could be a model that we can take elsewhere across the city. And so I'm going to pass it over to Teresa so she can share more about UBI.
Thanks, Cassandra. So I stuck a few links in the chat as you were talking. So there's a link to Russell, A Place of Promise. It's a landing page for now. We're working on building out our website, but you can sign up to receive newsletters and text messages and other communications from us. I also put the link to Cities United's webpage there as well, and you'll see that's also a splash page and a work in progress as that website is redone. And then I also added a link to Mayors for Guaranteed Income, and that site has a lot of information about advocacy, about the justification for UBI as a tool to address poverty, but also to address the idea that our current social safety net is inadequate to really give people the economic security that they need to move out of economic insecurity and poverty, and to address the issues that the rest of the speakers on this call have done such a great job of highlighting. And so for us, when we think about the impact of UBI on any city, but especially in Louisville and especially on the Russell neighborhood, we look at statistics like the fact that there are around 4,000 households in Russell. About 2,500 of them are female-led, and they're family households. And of those, about 1,900, almost 2,000 of them are female-led, with about 1,500 of those having children. And when you look at those statistics, and also at the fact that as of 2017, the median income in Russell was $17,264, you see that there is an opportunity to address fundamental living opportunities for people and fundamental economic needs for people in a neighborhood. And those statistics are not unique to Russell. There are other neighborhoods that look a lot like that set of data that I just shared with you today. And so universal basic income for us is about this idea of paradigm shift and about challenging our conscious and unconscious biases about how people address their economic needs and the root causes of poverty. And if you look at the social safety net that exists today, there's a real assumption being made about people who are economically insecure, that they don't know how to handle their money, and that it is somehow an individual choice to end up in poverty, to be in a situation where you're facing eviction, to be in a situation where you may need to use a payday lender or a check casher to meet your basic needs. And UBI really asks people to reconsider that notion. And when you look at the statistics and the data coming out of the pilot that Cassandra mentioned in Stockton, it really does dispel that myth that people are fundamentally responsible for their own poverty. And that people are able to make good choices with their money. And so when we see UBI happening in places like Stockton, some of the data that's coming out around that shows that people are using it for all kinds of things. They're using it to pay debt. They're using it to pay their rent or their mortgage. They're using it to pay their property taxes that continue to rise because there's been investment in a neighborhood without supports for the people who are living in that neighborhood today to remain. And so there really are only 3 points that I was planning to make today. I sort of got off on a tangent just then, but there are 3 points that I wanted to leave you with about universal basic income. And why we think it's such a promising solution to address not only our housing crisis, but also our really sort of universal paradigm around poverty. The first is that UBI is intended to be unconditional. So unlike SNAP, unlike housing vouchers, unlike really all the other programs that we have today that are supposed to be for addressing poverty, universal basic income comes as a guaranteed monthly payment with no strings attached. It is a $1,000 check or a $500 check or money that's placed on a debit card that doesn't require the user to spend it in a particular way. So it's flexible. It can be used to cover rent. It can be used to cover food. It could be used to cover a medical procedure that you've been putting off for a really long time because it's really expensive to get that done, but it could be life-changing for you to have had it done. The second point that I wanted to make about universal basic income is that it's really fundamentally justice-based. It's not about charity. It's not about people who need something to be given to them to make their lives better. It's about recognizing that everyone is worthy of being able to manage their own financial future and giving the tools that are needed to people to be able to make that future a reality. It also recognizes that our current social safety net is inadequate to meet people's basic needs. How many webinars have you been on where you've heard statistics about SNAP data and SNAP not being, SNAP for people who are not in the acronym lingo soup is the Supplemental Nutrition Assistance Program. It used to be known as food stamps. And yeah, I know I'm running short on time, Monica. So there's all kinds of data out there about how SNAP's not going to carry you through the whole month, and people end up needing additional support to meet their basic food needs. The social safety net's not set up to really address all the needs that are out there. And so UBI is a recognition of that fact and a recognition of the idea that if you don't tailor funds that come to people, they can use that money flexibly to meet whatever need they have based on their current situation. It trusts people to make good decisions with their money. And the third point that I want to make about UBI is that it's really intended to be additive. So it is a tack on to income, it's a tack on to other benefits that folks might be receiving, and it can be designed to address things like the benefits cliff. So you get to a point in your income where you're no longer eligible for benefits, but you still don't quite make enough money to cover your basic needs. And UBI can fill in that gap so that it really does create a pathway out of poverty for people. There's a ton more, obviously, that I could say about UBI, but I want to make sure that we get to questions. So I'm going to stop talking, and I know y'all are going to have some great questions for us.
Well, thank you, Teresa, and thank you to everyone on the panel. As you prepared to ask your questions, you can put them in the chat, or you could unmute, but preferably put them in the chat. I want you to notice that we're doing a brain flip. We're changing the House's Justice ecosystem here. We're changing how we discuss it and how we solve the problems. We're not doing charity, we're doing justice work. So thank you panelists for helping us flip our brains into this important new ecosystem. So let's see, I'm seeing lots of comments in the chat. Anyone have a question for anyone? It could be for anyone in the room, didn't have to be on the panel. Okay, well, okay, then, well, oh, Teresa, did you want to say something?
I could keep talking.
Well, I mean, we could talk about, those on the panel, if there were one thing you'd want us to take away. Oh, wait, all right, we have a question. Yes, Angela, she wants to know more about eviction diversion efforts.
I'd love to speak on that. And I see that the question is focused on what can Metro Council do, and I really appreciate. But in my opinion, what Metro Council can do, I would love to meet with anyone on Metro Council and present the many recommendations that myself and many other direct service providers have shared with the courts, especially legal aid providers who are in eviction court, because yes, eviction court is being facilitated on Zoom. And I just recently learned that the Zoom link was changed for eviction court, and not everybody was told about that. And so people were missing their court dates because they didn't know the right login information. I created a Zoom guide to hopefully share with the community to help people, because we know many of our seniors or many people with just lack of access to telecommunications resources may not be familiar with how to navigate Zoom. So there's plenty that I feel that the courts can do. And I think that oftentimes we don't think about that, the power that judges have to maybe create ordinances or do whatever it is and not rely on these archaic systems and to say that, oh, our focus is just the law. No, it's much bigger than that. You know, there are resources, there are models that we can use to provide court support and interventions, especially when you think about those power imbalances I mentioned before. So I really think we have to have a conversation on what is the responsibility of our judicial system in doing everything they can to work with community in preventing evictions, because evictions harm everyone, both the tenant and the landlord. So there's no reason that we're not having a larger conversation about that.
Thank you, Celine. Oh, go ahead.
And to piggyback on what Celine said, like there is a history of the courts taking a leadership role and really using their power to help people that are going through housing issues. And we look back in 2008, 2009, 2010, the circuit court took a leadership role in starting an eviction or a foreclosure reconciliation program that they based out of Cleveland. And we have yet to see any kind of like affirmative leadership from the district court to own this issue and really help work with community organizations and community health workers and assistance providers to like coordinate these efforts. And without like that firm leadership of an elected official, like it's hard to, we are definitely punching below our weight. If we would be much better off with like an elected official helping us lead this.
Thank you, George. I think that kind of could lead into the next question for anyone on the panel or anyone. If Metro Council was going to do one thing to promote housing justice, what would you recommend? I know y'all got some ideas.
I would want to have a conversation about the way certain processes work as far as navigating resources that are offered by the Office of Resilience and Community Services. I think there's a lot of potential in the neighborhood places, but I think that in my experience at the CHW, when I've tried to work with my clients to navigate the financial assistance programs that were available before the pandemic, zero success rate. I have my master's degree. I have 40 hours a week to dedicate to trying to figure out how to navigate these programs. And I struggled. I was never able to figure out like who would actually be eligible for this based off of the criteria that are identified. So I think that we need to be in consistent communication with our Metro Council in order to provide feedback about what our clients or community members are experiencing. And I would hope that that feedback is actually received, and then maybe we can create new processes that help to make those resources more accessible. So that's what I would like to talk to Metro Council about.
And I think when I said, I know you all have ideas, the reason I said that, because if your heart tugs, that means you care. And once you realize you care, you need to realize that you're capable. So we're going to go from that heart tug. So I know everybody here cares. That means everyone here is capable of doing something. So don't be shy. Metro Council works for us, y'all. So don't be shy, and definitely don't be shy here. All right. So let's see.
So can I answer that question too?
Go ahead.
So I think something that I've learned from a lot of the elders that I look up to in community work is that, you know, budgets show priorities. And so when it comes to Metro Council, if Metro Council or other elected officials are saying that they prioritize the lives of Louisvillians, that they prioritize Black families or Black children, or that they prioritize these marginalized groups, but the budget does not reflect that, then that's an issue. And so what I would say is that really what we need to do as a city is reevaluate our city budget and where our tax dollars are going to, where we are investing funds, and reallocate funds to the places that need the support the most. And that to me is housing. And secondly would be education. There's libraries, all the community supports, right? So if we're really about this work of creating an equitable and compassionate city, would be reallocating budget.
Love that. And I'm seeing some movement in the chat. Mary, did you want to discuss zoning? You don't have to, just ask.
Yeah, I am no expert,
Okay.
but it just from the reading, that's really a question to the experts.
Okay. Does anyone want to speak to zoning?
Sure, I will. I will just say that right now we are actually going through a kind of a redesign of the land development code, a look at the land development code in terms of its impact on the both the production as well as the location of affordable housing in Louisville. And this has incredibly significant racial justice implications. It's a huge, it has incredible implications for the future development of Louisville, frankly. And so I would very much encourage folks to get involved in that process. You can follow MHC on social media. We are playing an active role in that process and trying to get as much information as we can out to folks so that they know, one, what is being proposed, and two, making sure that we're holding Metro Council accountable, right, and Metro government accountable to make sure that that process is continuing on as it should.
Can I also make a mention about Metro Council, because this is an immediate need as well. 2.7 million was originally set aside by Metro Council to help with emergency services during COVID. In that ordinance, it was last case scenario money, which means that an organization could not utilize those funds unless we showed that there were no other funds available. And in that time, and it was only available to current external agency funds, which nonprofits, which the Office for Resilience, you get in the weeds really fast. But essentially, the community ministries did not apply for that funding in the second half of last year because we were able to get much more flexible and more money from the Office for Housing because we wanted to get those rental dollars out. But now because of that, because there was a break in the amount of time that we could not request those funds because of what was in the ordinance, they are considering putting back the leftover funds, which is a little under 2 million, back into the budget, potentially towards things like infrastructure or what have you. So it is, for me, I really want to make sure that that money continues to be used for direct client assistance. And so that does not get put back into the budget. There is a tremendous need. And just because the community ministries we have a limited capacity here as well, right? So we said, okay, we needed to spend $21 million by December. We're going to spend the Office for Housing money in order to make that happen. That people should not be reprimanded for that reason. So making sure that that $2 million stays in the budget for people who need it.
Thank you. Andrew has a good question in the chat. If we don't have time to completely answer it, would any of you mind connecting with Andrew at a later date to answer his questions and maybe make some relationships? So could anyone briefly start this answer? Can someone talk about efforts to create housing cooperatives?
Yeah, I'll start off with this, just because this is something that we're exploring with Russell Place of Promise. We do think it could be a viable strategy for one, curbing gentrification and lifting some of the burden of home ownership when you have multiple people that are owning property together, and so and scale up the needs and hold the burdens of the cost of home ownership together. We want to explore that opportunity with residents and everything that we do, all the strategies that we are trying to push forward. So it's something in the very early phases, but I know Teresa has some insight on housing co-ops that she could also share as well.
Thanks. And I won't take too long because I know we've only got like 6 minutes and probably more questions to go through. We are, as Cassandra said, interested in exploring the creation of lots of different kinds of cooperatives with Russell, a Place of Promise, including potentially our future organizational form being structured as a resident-owned cooperative in Russell. But housing cooperatives, we have seen a lot of interest among individuals in this concept, but I have not seen any direct efforts to organize those kinds of cooperatives in Louisville. Now, beyond the idea of a housing cooperative, we have been really excited about the work that LACE and the Louisville Community Grocery have been doing to start a grocery cooperative. In fact, the Louisville Community Grocery was part of a small business accelerator that we just wrapped up with Russell, a Place of Promise. We're really excited to have been able to support them in that. But we really are not seeing a ton of movement in the growth of residential cooperatives, at least not in Louisville, but we can look to places like New York, we can look to places like Los Angeles and see great examples of that. And then we can also look to tenant equity building mechanisms. There's a great one with the Northeastern Development Corporation in Cleveland. We are getting ready to launch a tenant equity or a tenant wealth building strategy attached to some houses that we're going to be building in the next 6 months with Rebound. And so there are some things that are not exactly cooperative ownership, but are trending in that direction. And as we continue our work in housing development in Russell, cooperatives are very high on our list, especially mutual interest cooperatives, where you have a group of people who come together around a common interest or a common need.
Thank you, Teresa. I think this is a good conversation about cooperatives. So I would love to have these connections going in the group so we could get that discussion rolling more in our community. So let's, after this, take some time, send some emails to each other and just brain dump on how we can get some traction on that. As we wrap up, I want to reach back to the beginning where we talked about what we were thankful for. I just want you to think about one thing you're thankful for having been here today. I want you to feel your heart tug. I want you to feel your chest get tight because you're stressed and you don't like what you heard. I want you to embrace that pit in your stomach and the fact that your brain may feel a little fuzzy right now, and recognize that that is your call to action. Recognize that that is your passion for justice. Recognize that that is your strength to help this community be better. And just don't be afraid. Take it, grab it, run with it. If your heart's tugging you, let it pull you to where you need to be. So thank you all for being here. This was amazing. And all the presenters, you stuck within your time limit. Like, that doesn't happen. So thank you. And then with that, I'll switch it over to Ben.
I just want to echo Monica's gratitude and to thank her for creating such good space for us. This was one of the best conversations that I think GLP has ever hosted. So thank you. And thank you very much to the team who has helped to put together this data in ways that I hope will be useful, and also continues to drive the desire for the Greater Louisville Project to provide data that really does catalyze action. I would be remiss if I did not thank our several board members and funders who are on here. So Jeff Polson, Stephen Riley, Trisha from the Community Foundation. I think I saw Walter and Dr. Kelly Pryor from Humana Foundation and CENS Foundation, I think Tess and Tony. So thank you all so much for being a part of this. And if I missed anybody, please still continue to cut us checks. I also just want to say thank you so much to the amazing and passionate group of people that we have here. We have the answers, and I love the focus on human-centric design and really empowering and honoring the experience of the people that we are attempting to serve and elevating those voices. So thank you so much. A couple of upcoming things. We are hosting a civic data nerds gathering, as we do once a quarter. We have between 30 and 50 people who we used to feed, and now we just wave at. So the next one is February 10th. Please join us for that. We continue to have shifted within the Greater Louisville Project to these smaller mini reports that we're trying to make targeted and make really accessible. So rather than doing one report per year, we're trying to create a handoff in partnership with the amazing work that has been done with the Path Forward. So If there are ways that we can be useful to you, I think Dr. Unseld really teed this up at the beginning. That is our job. So questions that we have not yet answered or that we could answer more clearly, areas that we could dive into more depth, even highlighting what we don't know is really powerful. One of our reports that's going to come out soon is about missing data and the groups and topics that we are not hitting well. So thank you all so much for your presence here, and we look forward to the next one.
Thank you all.